In today's video, we're going to answer this simple question: can I move with my Medicare plan? So we're going to break this video into 3 parts and we're going to get started right now. So the first part we're going to talk about is Medicare Advantage plans. Can you move with your Medicare Advantage plan? So Medicare Advantage plans are based on service areas, okay? Meaning that the network is based on where you live at, right? So if you're moving from one state to another state, even from county to county, you may have to change your Medicare Advantage plan if you're moving from county to county. Now, if you're moving from one state to another state, then you absolutely need to go ahead and change that Medicare Advantage plan, because that plan would no longer be available in your new state. Because like I said, it's based on service areas. So your network was based on the state that you lived previously, okay? So you have 60 days to go ahead and enroll in a different plan, meaning that you have a special enrollment period, which is SEP. You have a special enrollment period to go ahead and switch over because you have moved. So the reason for you to be changing is because you have moved, and like I said, you have a special enrollment period. So it's going to be very important when it comes to looking at doctor networks and such. If you don't know the area that you're moving into, then I would definitely recommend that you call our office and we could help you look for doctors in your area. Because remember, when you're looking at Medicare Advantage plans, it's going to be based on provider networks, the doctors that is in network, specialists that's in network, hospitals that is in your network, okay? So you definitely want to look at that when you're looking at switching over from one Medicare Advantage plan to another Medicare Advantage plan from one state to another state. Now, say you have a particular plan, you're with a particular company such as, let's say, Humana or United Healthcare or Aetna, and you want to stay with that company. Well, if Humana, Aetna, United Healthcare, or whoever have a plan within your new state, then that plan may be fine and it may not be fine, because like I said, it's still going to depend on the service area. A plan that may be great in Florida under United Healthcare may not be so great if you move to, let's say, Georgia, right? Maybe the network is not as great under United Healthcare. So you still want to shop around to make sure that you're on the best spot. You may have to change carriers, like I said, or you may not have to change carriers. You always want to look at doctor networks, hospital preference. You also want to look at the benefits that you love, that is important to you, such as dental, vision, and hearing. You want to look at if you have anything special going on, such as dialysis or home health. Are those providers going to be in network, okay? So the whole point is, if you have a Medicare Advantage plan and you're moving to another state, you do need to go ahead and change that Medicare Advantage plan, because it's not going to work in your new state. Also, it's very important to take note that if you're on a Medicare Advantage plan and you want to switch to a Medicare supplement plan, when you move, you do have a guaranteed issue right, meaning that you could shop around for a Medicare supplement plan without going through underwriting. Now, please take note that there are going to be limitations under the guaranteed issue due to moving to another state. So you're going to have limited choices of a Medicare supplement policy. Okay, it's going to depend on your state as well, and the Medicare supplement company may have their own limitations. So keep that in mind, that you can get on a guaranteed issue Medicare supplement plan, but there are some limitations on what supplement plans you can enroll in, and it's going to be limitations as well depending on the insurance carrier supplement company that you want to go with. Okay, so keep that in mind about guaranteed issue rights when it comes to Medicare supplements due to moving. Now let's talk about Medicare supplement plans and moving from one state to another state. So what can be the changes when it comes to Medicare supplements? So when it comes to Medicare supplement plans, you can keep your plan. However, you may see an increase in your premium or a decrease in your premium because the Medicare supplement plan premiums is based on your location. It's based on the state you live in. It's based on the zip code that you live in. You would typically see a increase or a decrease when it comes to your Medicare supplement premiums. Now let's talk about your Part D coverage, your prescription drug coverage. So if you're on a standalone drug plan, do you need to make any changes? So usually with a Part D plan, that plan is good within your state. Now when you move to another state, then most likely you do need to go ahead and change your Part D prescription drug coverage. Same thing applies. You have 60 days to go ahead and change that Part D plan due to the special enrollment period due to moving, okay? So yes, if you on a Part D plan and you move into another state, yeah, you definitely need to go ahead and shop around for a new Part D plan based on your state. You could do this by going to medicare.gov and plugging your medications. It's going to let you know what drug plan would be best for your situation in your new state. Of course, you would need the new zip code, and yeah, it will plug in all of that information for you when it comes to the best drug plan for your situation. And of course, you can always call our office as well. If you are moving to another state, we'd be more than happy to assist you with your Medicare Advantage plan, Medicare supplement if need be, and of course, the Medicare Part D, your prescription drug coverage. Thank you so much for watching. If you have any questions, let me know in the comment section below. I'd be more than happy to answer your question. If you know a friend that needs this video, share this video with a friend. If you're not subscribed, subscribe to see me again. Thank you so much for watching, and I'll see you on the next video. Ciao for now.